Good afternoon. Thanks for being here. Busy few days. Unfortunately, we lost another member of our community yesterday, a Caucasian male in his 80s with underlying medical conditions. We now have lost 209 residents of Onondaga County directly related to COVID-19 since March 16th. So again, sympathies for his family, and certainly please keep everybody impacted by this in your thoughts and prayers. Testing, good day on testing. Actually, a fantastic day on testing. 6,432 tests back. Our 7-day rolling average is 1.2% right now. So we've somewhat stabilized between the 0.9 and 1.25 range, but certainly if we don't start modifying and hunkering down a little bit, not so much on our activity, but on what we're doing out in the public, there will be pressure on that rate. Hospitalizations are going up because we've had cases going up. There's a direct correlation with that. There's always been a direct correlation. When we have 10, 15 cases a day, hospitalizations are low. When you have lots of cases in a day, you're going to have people who get sick with this virus. So we have 25 individuals in the hospital, 9 in the ICU. Let's keep those folks in the ICU in our thoughts and prayers so they can get home and get well. Looking at who's in the hospital right now, demographic information, 16 Caucasian, 5 African American, 3 Asian, and 1 has yet to share their information with us. When we look at the cases, we've now had 4,919 positive cases. That's 46 new cases since yesterday. Certainly not 61 cases, but it looks like tomorrow is going to be a busy day for us as well. Even though we're doing a lot of testing, you're going to find more cases that way, but it's busy. We're very busy with our health department contact tracing. And it's challenging now, contact tracing, with some of the types of cases that you have. So everybody is very busy. Looking at the cases, what does it tell us? Different from where we were in the summer when we would get a cluster, we could point to everything. This virus is in the community. We've had 5 travel-related, 4 within New York State, 1 from Pennsylvania. A very large household contact number, 16. Again, when we get a positive case, there's between a 10 and 15% chance that someone in the house will become positive with COVID, based off of just how infectious the virus is and living conditions. So 16 folks these folks, the good news, these folks were in a quarantine, so our contact tracing on these 16 isn't necessarily need to be as robust, but again, it shows you that when you get that one case, it doesn't mean you box it in there. There's a high probability that from that one exposure, you'll have other exposures. 25 community spread, of which we know 12 of the sources and 13 unknown. When we look at higher ed, we had 3 students within the county. We had 1 remote student within the county, and then we had 3 out-of-jurisdiction transfers. So when you look at how many cases were transmitted in Onondaga County, it wasn't 46, it was 43, but those 3 cases become our cases because they are recovering in Onondaga County. So 7 out of 43 related to higher ed. K through 12, looking at our K through 12 numbers, let's see what we got here. We have 4 on-site students, 3 remote students. Again, if you are in a quarantine, your brother got COVID, somebody in your class got COVID, you're in a quarantine, meaning you're not in school for a period of time, but then you become COVID positive, it's going to show up in this data. You can get COVID and not have been in the classroom for an extended period of time, but we're still going to report it out by the school. Looking at that, 7 out of the 46 cases related to K through 12. When we look at the cases more, who have they impacted? 2,714 female, 2,077 male, 595 under 19, 1,076 in their 20s, 653 in their 30s, 590 in their 40s, 686 in their 50s, 515 in their 60s, 343 in their 70s, 292 in their 80s, and 169 in their 90s. Specifically, when we look at the under 19, the 0 through 4, 83 out of our 4,919 cases have been ages 0 through 4. This makes sense. If you think about mom or dad getting COVID, you still got to take care of your baby. And so this makes sense. 5 through 9, again, elementary age, 65 out of 4,919. 10 through 14, 75 out of 4,919. And then high school to early college, 15 to 19, 372. Certainly, we are seeing that's an active demographic, and we're seeing cases there. Looking at testing, a lot of things going on right now with testing. Certainly, our school testing continues at MBT Bank Stadium for symptoms, okay, symptomatic testing. The saliva test is essentially very, very busy. So if you want a saliva test, you go online, you create a MyChart account through Upstate, and you set an appointment. You can call at times. If things are busy, it will take long to call. 315-464-2582. Or we have a line at MBT Bank Stadium. Again, these are for our students, family members of students, and our faculty in schools. If you want to just show up to get a nasal swab, not a saliva test, you can. We encourage you to register in advance because if you don't register in advance, you're going to have to register there at register.cayugahealth.com. Again, testing is available Monday through Friday, 9 to 1 for our students and their families and faculty. Asymptomatic school testing. We've been doing this now for about a week. Today we were in Liverpool. This is our saliva pool sampling. We're going into the schools looking for hidden pockets of the virus. Tomorrow we're going to be at Onondaga Middle School in the West Hill School District with this. Certainly, this is voluntary. So far, none of the pools on asymptomatic, we've been doing it for a week, none of the pools have come back with any positives. That is the good news. Related to schools, we did receive some of the Abbott rapid testing kits. These are the essentially the these are for asymptomatic individuals. They come in a cartridge like this. Actually, if you saw this a couple weeks ago at the White House, they had a press conference. A general got up and actually did this. You open it up, you drop. You have essentially 3 or 4 drops of this fluid. You do a swab on yourself a couple times, put it in, and then essentially within 10 minutes you'll know if you are a negative. If you come up with a positive on one of these tests, we then would take you and have you get a regular nasal test to confirm that you are positive. But what we are going to do with these, we've received about 4,000 of these tests via the federal government through the state of New York. When we see activity in a school, we're going to let our asymptomatic saliva testing schedule go on. We are then going to come into the schools with these tests and again try to identify quickly who potentially could have the virus. So we'll follow the data there. We'll follow where we see positives, and then we'll go into those schools and quickly try to identify any other cases. Looking at cases in schools, I think this is important. So since September 1, we've had 1,135 cases of COVID-19. Children and staff in the schools account for 117 of these cases. So 10% of our cases related to K through 12 in that period of time. We've had a couple clusters with universities, certainly in that period of time. But I think overall, what we're seeing and what's important for the community to understand is about 4 or 5 weeks ago when we started having school, we were getting cases, and we knew we would, and our numbers would go up a little bit. But what we now know based off of the data is that our numbers on a day like 46 cases or 60 cases, schools are part of that, but the virus is in the community. So we have micro clusters with businesses because people went to work sick. We have micro clusters where we've had to have certain businesses take a day or two off because they lost their employees because people went into their establishment sick. So the reality is this is not the pressure we're feeling now, and we're probably going to feel this pressure through the rest of the fall and the wintertime, isn't because of school, and it's not because of college kids at this point. The pressure we're feeling now is because the virus is in the community again, and we need to re-engage and work on starving the virus. What else are we seeing? The reality is when we're dealing with K through 12 cases on a quarantine, on a busy day, we're going to be conservative. And I know that's frustrating some parents, and I know it's frustrating some teachers, but our job is to minimize the risk and exposure to the community at large. And certainly, if we had 10 cases on a day, we can go micro-target our investigation. But on a busy day, when we don't have that time available, because we are racing to get our arms around all these quarantines, we are going to be very conservative in our quarantines. When things lighten up, we'll go back and we'll reassess. But there's lots of guidance out there. We're always going to, right now, we're on the conservative part of quarantines. Dr. Gupta and myself, we wanted to really look at the data, study early quarantines, how many of the early quarantines converted into cases. We want to get there again because that will help us in how we quarantine moving forward. We just don't have time right now. So we need the public's help, and we need them to recognize what we're dealing with right now related to that. Also, we've talked about balance and how we need to live with this virus and how we need to continue to keep our economy open and to address the overall public health that we're seeing. Next week we'll talk about data that we received related to other public health crises, opioids, tough quarter in the second quarter. We'll talk about that on Monday. But as we shift into wintertime, we talked about how we're going to work to help our restaurants work on outdoor dining. Happy to announce with our Cultural Resources Trust, we will have $200,000 worth of grant funds. It will be up to a $5,000 match with the restaurant for investments in equipment to help keep their business going, whether it's tents, whether it's fire pits, whether it's heaters, whether it's igloos. There's lots of different things out there, and obviously we need to help our small businesses continue to operate moving forward into fall and into the winter. So those applications will be available next week for our small businesses and our restaurants to apply for. Saying that, happy to take questions.
You seemed very upset yesterday in your Facebook briefing. Wondering if today, maybe by the number it's a little better, but wondering if you're worried that 60 number becomes a short-term normal, maybe?
I think it will be. We're going to have a busy day tomorrow, whether it's 40, 50, 60. I don't know yet. I know we have cases. I know we have lots of tests again tomorrow. So when you look at the overall positivity rate, we're going to be okay. But this is, again, we're talking about action, right? We're talking about a lot of activity, a lot of pressure, a lot of work on our teams. We're almost at the point with this type of activity, if this is what we're looking at, we're going to be right where we were as far as workload in the beginning of the pandemic. So from a functionality standpoint for our government. Look, at yesterday was a tough day on cases, a tough day recognizing we're going to have, because of the virus is reemerging itself in the community, we're going to have our work cut out for us for at least 2-3 weeks. and then we lost somebody, right? We lost one of our neighbors, and we lost another one today. So it wears on you a little bit, and we're going to have bad days, and we're going to have really, really good days. And we had a lot of really good days over the summer and into the fall, and everybody let their guard down a little bit. And so we got to grind this thing out until there's a vaccine, and then the vaccine gets implemented into all of our communities most vulnerable. And so at that point, then I think you'll see some of the regulations starting to get back to pre-pandemic levels. But that's going to be in 2021, and we're still in 2020.
Ryan, how many contact tracers do you have? And given the greater activity you're seeing now, do you need to bring on more?
Yeah, so we have over 200 trained contact tracers. Again, many of these folks they have other jobs too. So we will be bringing on more contact tracers out of some grant funds we received from the federal government. And we'll be reassigning some other folks to do contact tracing as needed now. For a period of time, we needed that. We got through that. But again, when you look at overall at our operation, the virus has impacted us. We're 500 people short compared to where we were at the same time last year. So our ability to do this by ourselves is more of a challenge now. So that gets into your whole stimulus conversation, is the ability to fight the virus in real time is where the challenge is going to be, and keep everybody sane. A lot of parents calling about quarantines now. You know, my kid was 6 feet apart this amount of time for only, you know, I get they were in a class for an hour, but they weren't by him. I get it. I get it. But right now, we got to be conservative until we got time to really reassess some of these things.
So what? You don't have 200 working now, though.
Not now. We don't need that now. That's a big number. But for us to have to engage that 200 means we're not doing other things in county government, or not doing other things as well too. So our health department, we're bringing on other temporary positions through this grant where contact tracing is what they do. And we're reassigning folks that do other things that have been trained via Johns Hopkins to get back to this.
So roughly how many are working it now?
We probably have 50 to 75 people doing this a day right now.
And is the state providing help with contact tracing?
There's a system. Sometimes when Dr. Gupta wants to tap into that, she does. So there are state contact tracers. They've gotten better as the pandemic's gone on too, with more experience, so we have more confidence in teaming up with them at times now.
What's so difficult about contact tracing right now? Is it the sheer number of cases, or is it people being really active, or a mix of both?
Yeah, people active, but also some of these cases, and the ones we hear about most are school cases, right? So you have lots of people in a building. You have some students who might play a sport, might be very active, and then they go and they're hitting 8 or 9 different classrooms. In the beginning of the pandemic, we didn't have to deal with that related to contact tracing. When we had lots of people in a building, it was usually a senior center where you had everybody in their own rooms or in their own apartments. So it's more complicated. And so right when we started getting cases, it was very, I won't ever say it's easy, but you are looking at things. We want to study the way that we traced and who in this classroom, did any of them become household contacts, or any of them become positive after 2 weeks, and how did we do it? How were they positioned with everybody in each room? We wanted to get down to that science, and maybe we'll get back there. But not when you got 60 cases yesterday, 46 today, and probably more than 46 tomorrow.
Going off of that, the CDC changed their guidelines on
They did.
contact tracing. Are you adopting that new model of 15 minutes within 24 hours, or is it 15 consecutive minutes?
We do the states with 10 consecutive minutes right now. So whether we go to the new CDC guidance, I think Dr. Gupta and her peers are evaluating that. That's brand new.
Will that impact schools, do you think specifically?
I don't think it will impact schools based off of how we're quarantining now, because we're being very conservative now anyways. But again, the districts have been fantastic in this process with they're getting better at this and how to evaluate this. And some of the districts might want to help out with contact tracing. I've had teachers in districts ask me that, and we're going to look into that because the schools don't get impacted as far as in-person learning unless they don't have enough teachers to teach, because teachers end up in the quarantines. So your larger districts might take a day off, let the contact tracing happen, but then you come back the next day. We had a couple of the smaller districts that were impacted because of the specific cases and how unique that case was and how many interactions they had with teachers. And so these are all things we're gonna learn through and we're gonna get through. But right now, for the time being, for the next week to 10 days, we're gonna be very conservative with quarantines.
Do you have a quarantine total number in front of you?
841.
How does that rank where quarantine totals had been through the last 7 months?
It's getting a little higher. I mean, that number when we were looking at active cases, about 150 range. I mean, that number was more like your 500 to 600 range. So, those are larger numbers. And again, if we continue at this path, our active case range will be 250 to 400 active cases. And so, the reality is I don't think we're in a second wave. I think we are in a seasonal shift, and we need to modify some of our behavior that's gotten lax to address the seasonal shift. And if we can do that, I think we're still going to have more numbers than we had over the summer, but we won't be having 50 a day. You get into 30 a day, 20s a day. Those are all things that we can handle pretty easily.
Cortland County called this the fall surge. Do you agree or disagree?
So they have a smaller community, and in their community they had their college, which had large clusters that spread into the community. Smaller community, your restaurants got hit hard there. And now if you look at where their rates are, again, they're doing 600, 700 tests a day. It's a lot of tests for Cortland County. You got 50,000 people. So when you're at 5, 6, 7%, I think in that community that's a different spot than 1.1, 1.2.
Ryan, the 61 new cases yesterday, 20 unknown source, the 46 today with the 13 unknown sources. Is that alarming to you? How do you go about finding those unknown sources?
The reality is you probably won't find them until you have positives, and then eventually I'm sure there will be epidemiologists who will be able to connect a lot of things that we haven't been able to do yet when it's over. But that's the challenge, right, Tony? Is if you have community spread 12, you have the story on 8 or 9 of them, then the community spread isn't as large. But when you got these big numbers of unknown community spread cases, it's in the community again. And so it is. So we're going to have to adjust. And the biggest thing that has happened, that has changed, is this virus got back into the community. However it did, travel, however it did. People are getting sick, and they aren't modifying their behavior when they're sick. That's what's changed. We always knew we would have college cases. For the most part, those college cases are in their own little bubble. And if you look at their positive rate on college campuses compared to our community right now, the college campuses rates are better than our communities. So that's not what's driving this. We knew we would have cases with schools. That's part of what we need to have happen. We need kids learning again. You need kids dealing with this, dealing with the other public health issues. What has changed is the virus came back. We get sick. What do we do then? Do we stop? Evaluate our temperature? Evaluate our symptoms? I have symptoms of COVID. I don't think it's COVID. I'm going to go get a test. I'm going to call my boss. That's happening sometimes, but it hasn't happened many times. And what then happened is that these businesses where you went to work, your employees have gotten sick, your colleagues. And then you go to lunch, your server might get sick. And all these things have happened. You come back, you got eight cases there. These 8 people have families. 5 out of the 8 people's families get sick. Next thing you know, you got 13 or 14 from one decision. And that doesn't make this person a bad person, right? This is just ways that we used to behave and we used to do things that we now just have to modify our behavior a little bit. And we got the testing. And we're going to continue to have the robust testing. And we're working on getting more and more rapid testing too.
When you mentioned getting conservative on quarantine, can you explain to us what that means?
So what it means is, instead of saying I was 6 feet apart and had mask in a classroom, my teacher has COVID, we're looking at how long were you in the classroom. And if you're in the classroom 45 minutes, an hour, even though you might have been 12 feet apart from your teacher right there, we'd rather be safe than sorry in that. So we're gonna put you in a quarantine right now. Again, if we had more time to assess this each day and really dive into it, we might modify that to a degree. No guarantee, but we might.
Does that make it easier on contact tracers? I know you mentioned that there's a lot on them right now. Does that kind of help relieve some of that stress of having to, if it's a classroom, for
It helps
example?
with contact tracing, but also it helps us deal with what is now a seasonal shift with COVID too. So by being more conservative, we know these folks are going to be quarantined. They won't be out in the community, and that helps us as well. But certainly, we wish we could do the earlier version of this process with quarantines, and hopefully we'll get back there.
And staying on schools, the swabs that you held up, I know you mentioned that those will be for schools right now if there's a positive case, and then you'll do a classroom, for example. Is there any talks about getting those for public use?
It's all about resources. And so right now, when you look at our testing strategy, outside of there being testing sites across the community for people to get tested, it's about our community's most vulnerable. Everything we're doing related to seniors. When you look at who pays the ultimate price of this virus, it's been our seniors. And then when you look at the other public health impacts, who does that impact the most? It's kids. You could certainly parents with kids right now. A lot of mental health challenges going on. So what we want to do is really focus in on our community's most vulnerable with all the new technology that we get our hands on. But eventually we will have rapid testing, meaning faster rapid testing than what we already have for symptomatic folks. So quickly in, quick results, quick quarantine, quick isolation. It gives us a little bit more time than what we have. But these are this product, and there's other companies coming up with products like this. These are answers to reopening up your economy. How this works, and this isn't how we're using it, but how the manufacturer essentially has it, is you have an app, right? You download an app. You take this test. You then scan the app, and the result goes to your phone. And then say you have you're allowed to have conventions again, but you got to have a negative test within 24 hours. You then show your phone with the app, you're good. So this product is really designed to find ways to reopen your economy where people can be together again. Right now, we're going to use this to make sure that our already successful start of school is even more successful.
How's the child care situation?
So far, we have been doing better than expected with child care. We'll put probably more child care money in our budget, but so far, families have been, we've been able to team up different families, and families have been able to really support each other. But there's still increased demand, but not as bad as what we thought it could have been.
On rapid testing, the governor announced 3 free sites in Cortland County. We know why, but he also promised that kind of testing, I believe, to every county. What are your conversations with the state to get those here? And with so much other testing, how will you use it?
So we'll have rapid tests machines, similar to what Cortland County has in short order. The challenge is the test kit that goes with that. We will be getting a limited number at first. So we're going to work with the manufacturers, try to get our own supply chain going there. They're expensive. So you got to figure out, again, if you're doing the rapid test, symptomatic, you tie in with a lab, insurance could cover it. At some point, these are better solutions for asymptomatic. These are less expensive, and the federal government's giving the state lots of these. So we think we'll get our hands on more of these as well. But your standard nasal swab rapid test, 15 minutes, that is an expensive test if you can't get insurance to cover it. We're going to get some of them, again, via the feds through the state, but it's not a large number. So we're working on procuring those as we speak. But again, that's symptomatic testing that you do for that, not asymptomatic testing.
When everything was shut down in April and May, it was very easy for people to make their decision because there was nothing to do. You stayed home. But there doesn't seem to be a lot of clarity anymore on specifics on what people should and shouldn't be doing. We know the obvious. You've said it 100 times a day. Wear a mask, social distance. But do you go out to dinner with friends? Do you keep it to your immediate family? Halloween's coming up. Do you have a gathering with 10 people that you don't live with? These things I think people have done or are considering. Right. Who should they go to, whether that's right or wrong?
Yeah, I think you need to reevaluate all those types of examples, Andrew, and they're great examples, and everybody, myself included. Certainly, during things are good when I'm reading 6 positives tomorrow, and our infection rate is 0.3. You feel pretty good, right? And so you try to catch up with somebody you haven't seen in a while. That's not really where we are right now. So I think reevaluating. We're not suggesting you don't go have a meal with family or friends, but you have your own networks, right? And within your own networks, hopefully they're handling the pandemic and taking it as serious as we all are. And if so, then they're doing the right things, right? That doesn't mean that there's no risk. There's always risk. But that means that you should feel more comfortable. And again, I think that's what it is doing things within your own networks, not large groups, and certainly related to teens and, if you have kids in college, same thing. Find a group of friends, do the right thing, get tested. If you're going to hang out, let's grind through this. Got another 90 days, right? Let's grind through this, and then 2021 is going to be a lot better than 2020.
Ryan, what are your thoughts on the governor's micro clusters playing with the red, orange, yellow zones?
Yeah, so I think the governor, and again, I don't know what triggers the yellow, right? So we'd love to know that a little bit more detail. I see how it's triggered in other communities. I think the concept of micro targeting is better than lockdowns. Lockdowns aren't going to work. And so I think the governor's plan there is good. Go where the problem is. Let's all go all hands on deck, figure it out right there, and stop it. Again, public health is much more than COVID, and we're seeing other parts of public health deteriorating because of this process of the 100-year pandemic. So I think we're supportive of that approach. Again, we're going to work very, very, very hard to make sure that our community never gets to a point where we're going into one of those yellow, orange, or red. But there's only so much we can do. We need everybody to be on the team. The community is really responsible for the success that we had in the summer and the early fall. We're out here talking about it and explaining it, but it's the people who really starved this virus during that period of time. So we need everybody's help.
Ryan, the increase in cases has translated into an increase in hospital patients and a kind of an alarming increase in critical care patients. Is that just a natural outgrowth of the number of cases, or?
I think it's who, Tim. I think it's who gets impacted by this. I think if I'll try to get more data on the ICUs, but I'm going to make an educated assumption right now, as educated as an assumption can be. We all know what happens when you assume that there are certainly these 9 people. I would assume the majority have underlying conditions, and I would assume they're over the age of 65 years old. We'll look at that, though. I've been asking to understand the data. Again, I know there's been no college-age cases in the hospital since we've had college. We're triple checking, but my information earlier this week was there was no K through 12 cases that have been hospitalized. We're triple checking that though. So we know who gets impacted most by this. And so our job is to do everything we can to mitigate that risk.
What can you tell us about the park's employee who was accused of driving drunk yesterday?
The individual, it's a very sad situation. But that individual no longer works for Onondaga County.
Can you
Was he on
elaborate on the
duty while
sad
he was
situation? Can you elaborate on the sad situation? Sorry, Tim.
I don't want to get into too much. It's a personnel matter and a legal matter, but certainly there was no past discipline that would suggest this could happen, so that was, very, troubling what happened. So that's the individual drove. It seems the investigation drove from a park to WEP to drop off a car that needed to get fixed. For those of you who know us, that's where all the vehicles get fixed, is at our Metro plant. And then that individual drove home. So the mistake the individual drove is he drove a county car home, and then clearly made many mistakes after that. But certainly we do not. There's zero tolerance for that type of behavior.
Do you have an update on asymptomatic teacher testing?
Yeah, we're going to be in Onondaga Middle tomorrow, Liverpool today. No positives have come back from that. We've been doing, today's Thursday, we've been doing that for about 7 business days. Again, this will be more rapid response, asymptomatic testing. Our saliva is proactive asymptomatic testing, going through all the buildings, working with the districts.
Do you have any guidance for Halloween? Andrew brought up.
We do. We have state guidance that we're going to be getting out. We have our own guidance to add on that. Certainly, we encourage creative trick-or-treat costumes, but there's basic things. If you don't want to participate, just turn your lights off. But obviously, we recommend that if you can put candy out, if you can put them out on a table, where there's not that interaction, handing out the candy. I know some people like to see the kids, and that's fun, but we got to be distanced. But we'll make very available the other guidance from Dr. Gupta in the state.
I think your son got tested. You
Yep.
said he had a stuffy nose. How's he
The
feeling?
McMahon family's doing good. We're doing good. Trish, you know what? I got tested too. I don't know
I
if you
was-
heard that, but I was also
Well,
negative.
I was going to ask you to demonstrate that thing that you keep showing off.
Ann Rooney actually demonstrated it earlier. We're happy to report she was negative.
Well, she's not you.
Yeah. Well, there would probably be human error in the test if I did it right now. I want to see it done a couple more times.
Ryan, you've talked about the kind of people letting their guard down and having fatigue with COVID. What kind of cooperation are you getting from people who are in quarantine? Are you seeing a change in that?
I think people are cooperating for the most part. Certainly you have others that are cooperating begrudgingly and challenging your authority, and we have a lot of authority related to this. So, but overall, I think people, once the issue isn't once they got it, what happens, it's, what's leading to the uptick and how we can stem that. And again, what we do today is going to have an impact 2 to 3 weeks from now. So we could be doing, I've been barking about this for the last week. In a week and a half, we could have solid data because people are doing the right things. But I'm going to keep barking because that's my job. And we're going to keep telling people what the data tells us and what Dr. Gupta is seeing so that we can just continue to grind through this, keep our economy going, keep everybody in school, and get to this vaccine, which I think we're going to have a vaccine in 20. I think it's going to take a while to get that implemented to the community.
You want to keep barking, and you have kept barking, and I say that very politely. But what do you do to break through to people who haven't listened yet or have moved on from listening because everything seems better to them?
Yeah, I think people are going to, with numbers like this, it's going to hit, and how it's spread, it's going to hit people's networks. So people are going to see what this virus can do. And so I think that's, we're going to keep messaging. We're talking to businesses, explaining, we understand from a regulatory standpoint, maybe you've gotten a little lax too. There's no more lax. So we've had these calls. We're talking to companies, working with manufacturers, and these business owners are great. They want to stay in business. They want to keep going. They want their employees safe. They're making investments to keep their employees safe. We just need to change what has always been. We've always done this. I'm the biggest culprit of this in 2019. If I got sick, I get a cold, no matter what, I always just keep coming to work. I'm as guilty as any person. Not anymore. If I have symptoms now, I'm going to get a test. Even when I don't have symptoms, Trish makes me get a test. So that's kind of where where this is now. We need to get a test when we have symptoms.
Day a bad day.
I think today's a better day. I think it's tough anytime you lose anybody and you still have this type of activity. But I think it's just we're going to have to grind this out, and that's what it's going to be like. And we need the public to work with us on this, and hopefully it gets better before we get into a different type of seasonal pressure when we're really indoors.
Hey, just at the risk of repeating, I didn't hear your entire response about the drunk driver. Did you say he was on duty working at the time this happened?
Correct.
And he was coming from where?
Coming from, he and another employee were dropping off a county vehicle, to get repaired, and then on his way back to where I believe, and this is via the investigation, to get back to the park where he worked, he stopped at his house. And so at that point, I believe the presumption is that that's where the mistake started to happen.
So there was another employee driving with him at the time of the accident?
No.
No.
He drove from his job to WEP, drop off a vehicle, and then drove, or to pick up a vehicle. I think there was a vehicle. He drove and dropped off an individual to WEP to get a vehicle, and then he took a county car to his house. You're not supposed to do that anyways.
And so he was on his way back to WEP when the accident happened?
He was on his way back, I'm assuming, to the park that he works at when the accident happened.
Okay. Which park?
Beaver Lake.
And he's been terminated?
Yeah, he no longer works for the county. Other questions?